Did you know that on average, people with a mental health condition live 15 to 20 years less than the rest of the population?
What research has shown is that what we put in our bodies not only affects how we feel in the moment, it actually affects our likeliness to develop certain mental health conditions.
If you're struggling with depression or anxiety, eating healthy can support your recovery. And so even though you might know that eating healthy is important for you, sometimes knowledge is only a small piece of it. And so having supports around you that make the healthy choice the easy choice can make the difference.
Individuals who experience a chronic mental health condition on average live 20 years less than individuals in the general population. There's a lot of factors that play into that, but what we now know is a lot of that has to do with nutrition. When you dig into the data around why are people essentially dying 20 years earlier, a lot of it has to do with medical conditions like diabetes, lung cancer, cardiovascular disease. All of these illnesses are directly connected to what we're putting into our bodies.
I got diagnosed with diabetes about 8 years ago. I just took the medication that they told me to take, but I didn't find out how to take care of myself until when I went into the hospital. I eat what is called a diabetic diet. It's very expensive. We depend on Gilead for a lot of things, and the meals especially are a big thing. Because for some of us, the meal that they have in the afternoon, that's the only meal we have.
Spending money on a dietary program can assure healthy eating temporarily. Creating a nutritional system delivers sustainable health benefits over the long term.
Whenever you have a small infusion of money, you want to make the best use, the most efficient use of resources. So if I were just doing nutrition education, I could maybe help 10 or 15 people. If I create a system, then everybody gets the services. Programs that are already in operation to provide nutrition education, they already exist and they're looking to connect with community programs. So whenever you have a group who might be struggling to eat healthy, connecting them to the resources that already exist is an efficient way to use staff time. And then once the system's created, the system runs itself. And that's the whole idea of a public health initiative, is to get in, create, and get out.
Gilead is a mental health organization. We're a private nonprofit agency. We've been around since 1968. We provide services all the way from outpatient to high-end residential services for individuals that need extra support to live independently in the community. So our hope would be to bringing on a nutritionist to help us build a program from the ground up, that we could provide education, resources, training, helping our clients to understand practically what it means to live a healthier lifestyle by focusing on nutrition and making good choices. We have a wellness initiative here at Gilead. We're excited about it. We're putting a lot of energy into it, but this is a game changer for us. This puts it over the top. We are not looking to do a one and done project. We want to build on something that Gilead is already doing and take it to levels that we can't take it without that support. The individuals we serve, they didn't put their hand up and say, hey, I'd really like to have schizophrenia. They didn't sign up for this, so to speak. And when you start thinking about, okay, you have a mental health condition, and guess what? You also have a higher likelihood to develop medical conditions that, oh, by the way, can reduce your lifespan by about 20 years. If we can make an impact on just that one piece, if we can help clients live longer, live healthier lives, there's nothing better that I could think to invest my time in.
Gilead is looking for a funder to provide seed money to create a nutritional program that will last.